at a cow's heart. This is the left atrium, left ventricle. This would be the right ventricle, and then back here is the right atrium. This groove that separates the ventricles is the interventricular sulcus. Interventricular sulcus. And between the atrial and ventricles is the atrial ventricular sulcus. Atrial ventricular sulcus. The little flap at the end of the atrium is called the auricle. Just the little edge part that hangs over, auricle. This is the base of the heart. This is the apex. If we open it up, you're going to know that this is the left side of the heart because of how thick the myocardium is. So this is a very thick myocardium. It needs to be thick so that it can pump blood all the way to your feet. So it has to have the thicker wall. So this would be left ventricle. If we go through the valve, this would be left atrium. And if you look inside the atrium, you can see those folds of the atrium. That's the pectinate muscle. Pectinate muscle. This is the mitral valve. These are chordae tendineae. And then this that goes from wall to wall is trabeculae carni. Trabeculae carni. If it's a cord-like structure that goes from a valve to either papillary muscle, usually it's the papillary muscle, that's the chordae tendineae. So from the valve to papillary muscle is chordae tendineae. From wall to wall of the ventricle is trabeculae carni. Over here would be the right side. This one's cut a little weird, but this would be right ventricle here. And then if you go through the valve, that would be left atrium. And then the valve itself is the tricuspid valve. So tricuspid valve, right atrium, chordae tendineae, and right ventricle. Let's talk about the layers of the heart, and then we'll look at the vessels. We have from the outside in, so this thin serous membrane that adheres to the heart itself is visceral pericardium or epicardium. Visceral pericardium or epicardium. This muscle wall is your myocardium. And see the smooth lining here? That's your endocardium. The smooth serous membrane on the inside is endocardium. We kind of talked about it earlier. Let me kind of go back. This here is a really good example of papillary muscle. It's papillary muscle. All right, let's look at your vessels. If you're in, the best way for me to think of this is what chamber you're in. So we're in the left ventricle, and according to your pathway of blood, what's the vessel that leaves the left ventricle? And that's aorta. So you have left ventricle. If he has a pipe cleaner going through a vessel that leaves the left ventricle, it's aorta. Then if you know that's aorta, you know that these little cusps here are your aortic semilinear valve. Right there, aortic semilinear valve. If we're in the left atrium, and he has a pipe cleaner going through, if I can find the hole, through that hole. So we know we're in left atrium. Pipe cleaner is going through a vessel coming into the left atrium. That would be your pulmonary vein. Pulmonary vein, because the only vessel that comes into the left atrium is your pulmonary vein. Here we're in this is still right ventricle. And see these cusps, that would be your pulmonary semilinear valve. And the only vessel leaving the right ventricle is your pulmonary artery or pulmonary trunk. So that's pulmonary artery or pulmonary trunk. And that's the only one that you can really see from the outside. That's the pulmonary trunk. Now, if we're in the right atrium, that might be harder to get to. Sorry, I'll get there and I'll show you. So here we know that we're in right atrium because we've gone through an AV valve. This AV valve is your tricuspid because we're on the right side. So we know what chamber we're in is right atrium. If you look, this pointer comes straight up, so that would be your superior vena cava. Right atrium, superior vena cava. And then if it goes off to the side, like this one. So again, we're in the right atrium. The pointer's coming out to the side, so it's inferior vena What have I forgotten? Oh, this separation between the ventricles is called your interventricular septum. Interventricular septum. That's all I can think
So the
of.
moderator band, that doesn't have one, right?
This one does not.
So it's in the left ventricle or the right ventricle.
Right ventricle, and it's like a really thick trabeculae carni.
Okay.
It looks really thick.
Okay.